small dots and big dots. Google has clarified that the dots, the size of the dots depend definitely on the volume of traffic on the site, but also on the volume and star rating of the reviews. Those reviews, again, are very prominently defined and in front or displayed in front of your patients. The third page in this example is a set of review sites which come right below the map. Review sites like Yelp, like HealthGrades or Vitals, where patients can get additional information about doctors and physicians. Okay? Let's look at further in this run number 1 in search. Once you start clicking on this business, on a practice or a doctor page on Google, you're going to see, obviously, the first page is the basic information about the doctor, but you see reviews prominently described on that first page. The second page, the third page, the fourth page are just about reviews. Okay? So again, reviews and reputation dominate the search pages for patients. Run number 2, map. Patients are always mapping an office or a doctor or doing searches via map, and it works very similar. You're going to see that reputation display and those reviews displayed on the map. Those are Google reviews in the case of an Android phone. They are Yelp reviews in the case of an iOS iPhone. And on that map, you're going to see those reviews, whether the patient asked them for them or not. You won't see any other reviews than the Google or the Yelp reviews. And in fact, those points on the map will be also bigger or smaller depending on the volume and the star rating of those reviews. The listings below the map will be influenced by those reviews. In fact, if you look at the bottom of the page, the any rating and filter, patients can even decide to narrow their search to any doctors that have a star rating of 4 or above. And in that process, a number of those dots that you see on the map will simply disappear, right? It's as if they did not exist. So again, harnessing reviews so that you can show on the map, you can be discovered, you can show high on that list of listings is very important. Third and final is social. Social is ramping up significantly, particularly in healthcare, where people are looking for peers, reviews, feedback before selecting a doctor. And reviews, again, are displayed in prominently on social pages. Okay? So as you can see, reputation is displayed and very prominent across any number of channels to discover and select and find a doctor. And we know that many healthcare systems spend hundreds of thousands of dollars, if not millions of dollars, in advertising, in SEO, in direct mail, in print, in TV, right? And what this marketing spend does is really raise awareness for your brand, for your locations, for your practices, for your expertise. But what it does also is makes people want to look up online and get a sense of whether or not this is the right doctor or practice or hospital for them. And reputation, again, and ratings stand between this marketing spend and revenue, because often it blocks new patients from calling in, scheduling an appointment, or driving to this location. Let's talk about review requesting. We typically define online reputation management in 3 phases. When many of our customers in healthcare come to us, and they come with one realization, is that their CAHPS surveys, or their patient assessment surveys, give them one version of the truth, and usually the right one, which is what people actually think of their service. And it is really usually very good. If you were to translate that into a star rating, it would be in the 4 stars range, maybe 4.5 stars range. And then they look at their reputation online on sites like Google or Yelp, and then they realize that the reputation online, the star rating online, is much lower. So the first phase usually is to close the gap. And closing the gap is what we're going to be focusing on today, is how do you monitor your reviews and specifically reach out to patients to make sure that you have an accurate and representative set of reviews on those third-party review sites like Google and Yelp and Facebook, simply because this is where your patients are going to go. And the idea is there to close the gap, to make sure that those reviews are representative and in line with your patient's assessment surveys. Typically, the next step is to raise the bar as you get more reviews, more feedback from patients. There is an opportunity to not only analyze this feedback to improve your operations, identify recurring issues that you need to address, but also to respond to those reviews, right? Responding to those reviews online is very important to show this particular patient that you care, potentially revert this negative review, but also to show everyone else, every other patient or potential patients who are going to be looking at those and reading those reviews, that you actually cared about this feedback. The third and final step is really to take a lot of those reviews and start publishing them on your website, simply to promote your reputation and make sure that you can leverage that great content of positive reviews to gain better visibility, increase your local SEO rank for your own website. Today, let's focus on the first phase, which is closing the gap. To do this, you typically want to send your patients after discharge or after they visited your practice a request for review, potentially a survey. Those requests for reviews are optimized to be viewed either on a desktop or on a mobile phone. There's a variety of templates that you can use to be able to gather that feedback. Some systems may decide to start with a simple question: were you happy, satisfied, or not? Other systems may decide to display a star rating in their email request and asking the patient for a more granular view into their level of satisfaction, even before asking for a review. Other systems may decide to just ask directly for a review and suggest a few sites where they would like their patients to leave a review, like Google, Yelp, or even maybe take a survey. We have worked very hard in the past few months to make the flow of leaving a review on sites like Google and Yelp frictionless, very easy. For example, when a patient clicks on that Google button, they will typically be directly connected to the page of your business, of your doctor, of your location on Google. They will be already logged in and ready to write a review. There is no intermediate click. There is no need to log in. And that makes the conversion rate for writing a review much, much higher, potentially 3 to 4 times higher than if a patient had to log in or needed an intermediate click to get to that page where they can leave a review. Same thing for Yelp. We actually do a launch, detect if the patient has the Yelp application on their mobile phone, and we launch the mobile app on Yelp to allow them to write a review directly on Yelp, which makes it very easy. Or you can display a survey with multiple questions or a custom survey to ask for more granular and detailed feedback. In any event, what we see over and over again is a scenario where before starting their review request, a hospital or a doctor had only a set of sporadic, sometimes anecdotal reviews. After launching their review requesting and review solicitation process, you start seeing a much larger flow of generally positive reviews. And that changes the game for several reasons. One, it gives you content to display on your own website. Two, it makes the Google Maps, search, social a lot more attractive if and whenever patients go there to evaluate doctors. And even more important, and we saw that again over and over, when you start displaying those reviews on your own website and you do it in an SEO compliant manner. That means that Google understands that what the content you're displaying on your own webpage is a review content. It can be crawled as a review. Then you start seeing your own website listing gaining significant ranking in SEO, in local SEO, as well as having a set of star rating and volume of reviews being displayed. That's called a rich snippet, displayed as part of your own listing. There is nothing you need to do. Those reviews and those star ratings will start displaying below your listing automatically. And Catalyst Search Marketing, a marketing agency, has published a white paper and an analysis showing that people are 150% more likely to click on a listing that has star ratings than if it did not have any star ratings. So this gives you a sense of all the benefits of not only requesting reviews, but then taking action on those reviews. With no further ado, I'm going to let Anne-Marie jump in and share her experience with requesting reviews from patients for Meridian Health. Thank you. Anne-Marie, you may be on mute.
Okay, can you hear me now?
Yes, we can.
Okay, sorry about that. Hello, everybody. This is Anne-Marie Keevans from Meridian Health. Some of you may know we recently merged with Hackensack Meridian, but we started the process with Reputation.com last July, July 2015. So I'm going to be talking about our experience with Reputation.com and what we've been doing for Meridian Health. So Meridian Health is a vertically integrated non-for-profit hospital system. We have 8 hospitals, 1 university hospital, 6 community hospitals, and 1 children's hospital. We have over 100 physician practices, urgent care facilities, surgery centers, fitness centers. And the reason why I bring that up is when I start, we actually implemented Reputation.com with about 40 facilities, which included a mix of hospitals, urgent care, fitness centers, and then in addition to that, we also had about 270 physicians. So that's how we started. So Pascal went through a bit of, the journey typically of utilizing Reputation.com, and we did the same thing. We started off initially, just monitoring and consolidating and looking at our reviews online. Then we actually started responding to reviews, and then right before Memorial Day weekend, we started requesting reviews. And the reason we did that is when you look at when we started in July in 2015, our average star rating for all of our hospitals combined was 2.8. And while I don't have exactly what that would be converted into Press Ganey, it certainly wasn't reflective of what our Press Ganey results showed. And so we felt like the people who were going online unprompted typically were people who maybe were unhappy. So they were using that as an opportunity to vent online. So we felt like we wanted to give it a try to show something that was much more representative. So we typically had, later on I'll give you an example, but we typically, some of them, we had maybe 3 or 4 reviews in a whole year. And therefore, if you have 3 or 4 reviews and one of them is negative, it really does have a big impact on, someone looking at that. We all know if you have 100 reviews that, you anticipate, you expect actually some negative or, 3-star reviews. Otherwise, you almost don't trust it. So, but when you have a very low number, you really need to increase that so it's much more reflective. So we really had no process in place to get people to write reviews online, and I can say during this process, I'll tell you a little bit later, we started with the hospital. So once we started seeing, wow, what a positive result we had in the hospitals, and we knew we wanted to do this slowly, we even tried to do some offline, giving people's cards to try to give us reviews, and the results are kind of dismal pretty much. It's very hard to get someone to give them an offline card and have them go online and do reviews. But when we actually went forward and we requested reviews using reputation.com, we had a much, much better process. So in terms of, before we proceed, in terms of getting buy-in, I have to say right from the beginning, we have a chief marketing officer who's very progressive, and so she was very interested in making sure that we start looking at this whole thing. So right from the beginning, we got our senior leadership involved. So they actually, before we even signed the contract, we made sure that they understood the different aspects of reputation.com, that it would allow us to, monitor our reviews, that we could respond, and the importance of that, and that also we wanted to change things, so we were going to request reviews. So we did that at the very beginning. So as we started along the different segments or the different stages, we were able to proceed without too much of a pushback. So if we go to the next slide. So I can tell you I remember it well because it was right before Memorial Day. We sent out our first wave of request reviews. I should say that we actually decided we wanted to use our CRM system. And the reason we wanted to do that is because that allowed us to also make sure that we weren't over emailing our patients. If we sent them something, yesterday, we may not want to send them something the next day. I know that Reputation has the ability to monitor that, what you decide is how frequently you want to request reviews of people. But our process was that we had a rule that said we're only going to request reviews one time every 6 months for any given patient. So, and if the person did not respond to the first email that we sent, then we would email them one more time 5 days later. So they might just not have seen that email. So the first email has, please share your feedback. That was our first email. And then the second one said, how was your experience? So as the slide shows, we had, I can remember, I was like, wow, it's a holiday weekend and everybody's responding. So we had a huge response to our initial request for reviews. So in just 10 days, we collected over 3,000 responses, and we had 109 new reviews on Google and Yelp. And the average star rating, as I said before, our hospitals was 2.9. We now went up to, it was 4.5. So it was much more reflective, we felt, of how people, really view us. Pascal, maybe the next slide. So this kind of just summarizes it in terms of numbers. So for the whole, for our hospitals, for the whole year prior to doing this, we had 131 reviews. After those 10 days, we had 240 reviews. And we went from a 2.8 to a 3.8. So as you can see, that's really impactful. And that was our first venture, but the good thing is it continued. We did have some lessons learned. So one of the things is when we originally sent out our review requests, we included our lab, anybody who visited our lab. But what we found is because we are integrated, our physician, if a physician practiced and one of our physicians had ordered a lab and it went to our hospital, that also was counted in the lab. So after the initial, after we looked in, we had some feedback that said I had not visited your hospital. We did some research and we realized, oh, okay, we have an issue here. So then it reduced the number of requests we're sending out, but we decided to take out the lab so there weren't confusion. So next. So I wanted to give you an example of for one of our hospitals. So this actually, I just ran this the other day. So for 2015, for one of our hospitals, we had only 3 reviews for the whole year. And the average star rating was a 3.7. So they were pretty much almost non-existent as far as our patients were concerned. But if they went online, you see that they had a very, a negative review there. So after this, and you can see also they had a very low reputation score. I think their reputation score was 180. So that's very, very negative. So then after it, when you look at it, this is as of September, you can see, we now have 52 reviews, and their average star rating is 4.5. And then, additionally, the reputation score is over 700, and they're in the good category. We're not best in class yet, but we're definitely have made huge progress. And I can tell you the leadership of that hospital was very happy with the results. As you can see, the number of reviews went down, but part of that is that taking out the lab, and we definitely see it's cyclical sometimes, and one hospital will get a lot of responses, and then another hospital might get a lot fewer. So you can never really tell what the response is going to be from month to month. But a big part of it also is collecting those emails. So we can only send out reviews if we have emails. And so I can tell you for some of our hospitals where we have a lot of physician practices, we have a lot of emails because all that information is fed into our CRM system. For hospitals that, some of our newly acquired hospitals, we don't have as many emails. So we won't get as many reviews back from that. Okay. You can go to the next slide. Okay, so in conclusion, we continue to request reviews monthly for our hospitals, and we continue to see positive results for that for each and every one of our hospitals. Next, we're going to start with our urgent care and after hours, and I'm very excited about this because our urgent care and our after hours, a lot of them have almost no online presence. So some of them are new facilities. People aren't even aware of them. So we really feel like this will give us an opportunity to see like the impact more so than our hospitals, in terms of, as Pascal showed you before, in terms of our Google rankings and things like that. For the hospitals, I feel like we're managing a lot of other things with that, but with the urgent care and after hours, I feel like it's going to be interesting to see the impact that has, request reviews on our, what happens in terms of our volume, our business, and, just our overall visibility online. So I definitely think that one of the things I didn't say is the way our CRM works is that our CRM, we get the data once a month. So by the time we're sending the data out or the request out to patients, it's probably somewhere between 4 and 6 weeks from the time the patient has been to one of our hospitals. So there is a lag, which we would probably get better responses if it was closer. But that's the decision we made that we're going through our CRM. So the good thing about that is then no one really has some concerns. We really, for those people who had concerns about press gaining and impacting the responses there, if we're sending these out 6 to 8 weeks later, or 4 to 6 weeks later, then we're really not impacting press gaining in any way because usually that goes out like within the week. So that helped us to, overcome any objections we had on that issue. Next. And then the added benefit of the request reviews is that you get additional feedback on your hospitals or your facilities. So, for example, this is one of our facilities, and it shows that, we had quite a few requests go out, and it gives you you can see that most of them were 4 stars. some of them 1 star, and so it's another way of gaining insight from your patients. The one thing that did happen with us is after we started this, our actual when someone gives us a 1, 2, and 3, that's when they're asked if they would like to give us some feedback because their experience wasn't up to our standard. And what's happening is some people are actually writing quite a bit. So initially, in the email, we said, please provide feedback so we can share it with our team members. But some of the feedback that's being provided really warrants a response. So then we really need to get our guest relations people involved so that they can then go online and respond to some of these as appropriate. And if necessary, we actually put it in our CareLink system. So that's all now. We had to make sure that we got our guest relations involved and online on reputation.com so they can then respond via the system because it's very easy to do that. So I think that's it.
Thank you, Anne-Marie. So back to me, Pascal, for one more slide. And before we get to that one more slide, I want to really make one point on the CAHPS surveys. Many of our health systems are usually reluctant to initiate a program to go and ask patients for writing a review because they're concerned that might interfere with their CAHPS survey. Anne-Marie shared that in her case, the CAHPS surveys don't even have the same timeline as the review requests, where those review requests are sent 4 to 6 weeks after discharge or after a visit. We also know that the guidelines from CMS, particularly on CAHPS surveys, are very clear. CMS requires at least 300 surveys filled in per year. And after that number, having any more surveys doesn't change the reimbursement process. It's only if obviously you get a better star rating. So we have a number of health systems who will always try to do as many surveys as they can to get to the best possible star rating. But there is a point of diminishing return where additional CAHPS surveys above that minimum 300 threshold per year will not change the star rating, will not change the outcome in terms of reimbursement. And this is usually the perfect time to switch over and start asking for reviews. So a couple of reasons to do this. We'll leave it to you to kind of decide how you want to engage with reputation.com and start collecting reviews. Let's look at the 5 key takeaways from this session so that if there is anything that you want to do and a follow-up after this webinar, and that's basically the goal, you can use those 5 key takeaways to convince your management team or work with reputation.com to get started on initiating requests for reviews. So first, your reputation is prominently displayed in maps, search, and social. So it's really important to make sure that those reviews, you've taken control of those reviews on all of those channels. Recent reviews affect your local SEO and the discoverability of your listings, both on search and maps. So making sure that you have connected reviews is very important. Even if you had, at some point, 6 months ago, you had 30 or 40 reviews in the bag, that's not enough. You need to keep refreshing that pool of reviews because we've seen over and over again those listings on local SEO, they start drifting down if you don't populate them with more reviews or new reviews. Number 3, requesting reviews is critical to ensure a fair and representative ratings online. Anne-Marie shared her story of the historical review showing a 2.8 star rating compared to a Press Ganey CAHPS that was much higher, and the fact that by just asking patients for reviews, they were able to get an average 4.5 star rating, which ultimately changed the game in terms of how those hospitals look online. Number 4, requesting reviews can be achieved without interfering with ongoing CAHPS processes. I think we've talked enough about this one. And number 5, think about leveraging those reviews you've collected to promote not only your CAHPS surveys on your website, as well as reviews and star ratings, so that you can promote and grow your listing and grow your local SEO rank. This is hugely important if you want to have one, being more discoverable online, but two, get patients wanting more to click on your listings because there is a set of stars and star rating displayed right there on the search on the search results. Let's move now to our Q&A session, and for that we're going to be collecting questions from the audience if you have any, and then we will share. Mary and I will share the responses. So we're starting to see a few questions coming in. So this is the first question for Anne-Marie. Anne-Marie, what were the biggest challenges that you faced in order to get buy-in for this program? What helped push this through?
Well, as I said, I think having first of all, starting off with having progressive CMO, but then also getting senior leadership involved. That was really, really important. And then the other thing was getting key constituents. Like a big part of it was when we started, we needed to make sure that the guest relations team was knowledgeable and involved, and they knew what we were doing, because this is their business, is responding to customer complaints. So that was a key part of it, is just making sure that you know the right people to get involved and inform them early on. The other part was, as we talked about, is the whole idea of not interfering with, the CAHPS survey. That's really important.
Great. We have another question related, which Anne-Marie will answer. How did you manage the process internally to respond to reviews, and what have you seen so far that worked well?
Okay, well, responding well, that was as I said, the monitoring is easy, but then when you start to responding, that's when we started realizing you really need to get a lot of different people involved. So with responding to reviews, one of the key things that we found is we had to develop a process. So we had I put together kind of a formal process that then I reviewed with our legal. So legal had to agree that this is how who's going to be responding, and we made the decision that it should be our PR manager hospitals or our PR or marketing team, because we wanted to make sure that when we're responding, everything sounds appropriate and everything's well written. So that's first of all. Then the second thing is, we needed to make sure that whatever we're responding to, that we're doing it appropriately. So our process is that every time we develop a response, we run it by risk management. We have developed what we call a library of responses. So if it's very similar, if one review is very similar to another, we can then use our library of responses, and it doesn't have to go through that review process. But we did need to get both legal, risk management, guest relations all involved in that, because the guest relations also need to know, because very often our response is, if we want to understand more what the person's complaint is. So we say online, our goal is, to have, for patients to have an excellent patient experience, please contact our guest relations, and then we give them the number online. That may be our response, because very often we need to understand a little bit more about the situation so that we can really deal one-on-one with the patient. So that was quite a long process, but now it runs very, very smoothly.
Thank you, Anne-Marie. So we have a third question that I'm going to start answering, Anne-Marie, and if you want to add anything, feel free to. Can you explain in detail how requesting reviews does not affect CG-CAHPS? Okay, so there's a couple of ways you can deploy review requesting, again, without impacting your CG-CAHPS process. Number one, typically when you do CG-CAHPS, you're gonna do it right after discharge or right after a patient visit, and so the CAHPS survey, the CG-CAHPS survey happens first. What we do is we recommend that you don't wait too long, but typically after 4 to 6 weeks, patients either have already responded to their CG-CAHPS survey, or they have not and will not respond to a CG-CAHPS survey. As you know, CG-CAHPS guidelines are very clear about how many times you can ask a patient over a period of time to fill out their survey, either by phone or by direct mail. And the 4 to 6 week period is well outside of the timing to repeatedly ask a patient. So at this point in time, you basically end up asking, reviewing or request to reviews to 2 types of patients. The ones that have already answered their CAHPS survey, that does not impact your CG-CAHPS survey, or the ones that have not and will not, are at that point outside of the scope of the CAHPS survey. So that's the first reason. The second reason that I mentioned earlier is as you start gathering, collecting CG-CAHPS reviews, today there is no mandate on CG-CAHPS in terms of how many CG-CAHPS reviews you need to do, and even whether or not you need to run CG-CAHPS. The only mandate from CMS is to run HCAHPS, which is the only one today that drives reimbursements. CG-CAHPS doesn't, but we believe that when it does, which will happen, there will be a minimum threshold or a minimum a target volume of surveys that you need to achieve every year for a doctor to qualify for the reimbursement through CMS. And we believe that that number will be small enough. Right now it is 300 for hospitals in HCAHPS per year. That number will be small enough. Then after you've reached that volume of surveys, CG-CAHPS surveys throughout the year, you can start switching and having a number of your patients being directed, a percentage of those patients being directed to a review request process. We see this commonly done in other industries where after you've gathered enough of your own survey results and that are statistically significant and where you reach a fairly stable rating through those surveys, you start directing a percentage, 20%, 50%, a growing percentage over time of your patients to catch up on third-party reviews. Anne-Marie, anything that you would like to add to this?
No, not really. Actually, I haven't had anybody complain, that they feel like it's, affecting our response rate for CG-CAHPS. That's all I. Okay,
great. We have a third question, which is I'm gonna take that question more broadly, but then I can answer that question more directly, which is regarding the process of responding to patient reviews, particularly in the case of a managed service offered by Reputation.com. And there were some questions about how the process works, how do we involve the operations teams or maybe the patient relations teams to actually correct the issue with a patient. Well, we have at Reputation.com a managed service and a responder team, which is trained to respond to patient reviews in healthcare. In fact, they do several things. The first step for that when you engage with them is to be able to monitor reviews for HIPAA compliance. They're trained to monitor and detect when reviews, particularly when you run your own reviews. We call them direct reviews or first-party reviews. This is when you collect your self-reviews for your own website in addition to CAHPS. They're trained to figure out if those reviews would violate HIPAA privacy regulation if you were to publish or stream those reviews to your website. And in that case, they flag those reviews. They also typically flag third-party reviews, even though they're already public on sites like Google or HealthGrade, if they believe there is a HIPAA violation risk, if you were to, again, republish or stream those reviews on your website. Then they may respond to those reviews. Typically, they will, if a review is very extreme, they will share that review with the health system to make sure that they can address that review properly. In some cases, the health systems decides to handle that response themselves and directly. Sometimes, and in most cases, the response is relatively generic, but invites the patients to reach out to the patient relations team. And then from that point, the patient relations team owns interacting directly with the patients. In the case of correcting and finding issues, well, those reviews are always indicative of an issue. And we just released a feature last week where we have machine learning and artificial intelligence that automatically reads those reviews, identify what topics people may complain or rave about. Is it the staff professionalism? Is it the wait time? Is it the ability to park and find a parking spot near the location? Is it the overall appearance and cleanliness of the location? We have a specific taxonomy of topics that that has been optimized for physicians, and another one for hospitals and practices. Our system reads those reviews, automatically tags them with those topics, and then helps you identify recurring issues, trends related to specific topics at specific locations. And the only reason we did that is to make it easier for you to start identifying topics that really come out as recurring with real issues, not anecdotal issues, but real issues that you need to address. And this is typically where you want to plug in your operations teams to start communicating those issues to them. I think at this point we don't have any more questions, so I'm going to thank dearly Anne-Marie for her contribution. Thank you everyone for joining this webinar. Obviously, if you have any more follow-up questions, you can engage directly with your customer success manager, and we'll make sure to address those questions diligently. Thank you everyone.